Hey guys, so last night I was looking at some stuff on Reddit and I'm on a thread that someone had asked questions about CNA clinicals, and so some people shared advice in response to their question, and I thought that it would be helpful to share with you guys in case any of you are either looking at going to CNA training or are in CNA training and maybe haven't started clinicals yet and have the same sort of anxiety about the clinical experience. So this person said, CNA clinical, I'm scared for clinicals. Everyone else already has experience, but I literally have none and I'm nervous about my clinicals. Any advice? Okay, so I'm going to share these people's advice, and if I have anything to add at the end, or as I'm sharing this information, I will share my thoughts as well. So somebody said, when doing a shower, ask if the temperature is okay before spraying individual. If you open a shut door, close it behind you. If someone gives you instructions but you don't understand, ask instead of guessing. For example, an aide told me to flip an individual without moving their hip because they were recovering from hip surgery. How would that be possible? These are all things that got me snapped at in clinicals. Do not antagonize individuals. For example, an aide mean-mugging an individual, teasing her for giving her a hard time the previous shift, was chastised in front of everyone because it's inappropriate for dementia patients and disturbs them. Outside of clinicals and just working in healthcare, be prepared for other employees to treat you like crap, tell you no, or just in general, give you resistance any chance they can. Somebody said, don't let the regular employees force you into a situation you are not comfortable with. The patient's life and well-being are in your hands. If you are told to do a task you are not familiar with, you need to be straightforward with telling whoever is supposed to be training you that you cannot perform the task, but that you want to learn, so that they can teach you hands-on. I never pulled an IV during my clinicals, and a couple weeks into my NST job on MedSurg, I was asked to pull one. I was upfront with all my staff, nurses, and fellow NSTs that I am not familiar with the task, but if someone will come with me and walk me through each step, I will do it. People want you to learn. It's going to be scary doing new tasks, but you have to just throw yourself into it. Also, I just wanted to let you know that I've had my CNA since October, and this, like I said, this post was very, very recent. So they haven't been a CNA that long and have been working on MedSurg since November with an additional 4 years in inpatient psych. You can totally reach out to me if you have questions or anything. I need fellow CNA friends. First of all, don't just go pulling IVs, because in the states that I have worked in, CNAs are not allowed to do that. Unless you have like specific training or it is within the scope of practice for CNAs in your state, you should not be doing stuff like that. As far as like anything with IVs, in Indiana and in Michigan, you cannot do that. Like, CNAs are not allowed to touch IVs. You're only allowed to silence like IV pumps if they are beeping, but you're not allowed to like put them on hold or stop them or anything like that. So just be wary of the scope of practice within your state. Don't be afraid to ask for a couple more days of training if you feel like you need it. I went into clinicals without any experience other than what the instructor taught me. Nervousness is part of the process. It'll hang on to you, but don't carry it. Ask questions to the CNA that you were instructed to shadow and help. Be excited, assist with everything. Clean the dentures, operate the Hoyer lift, wipe the tushes, talk to the residents, rinse and repeat so you can move forward and accomplish more objectives. I kind of like the way that they wrote that. Someone else says, it's normal to be afraid, but I promise you are going to be okay. Don't be afraid to ask questions. I've trained a few students now, and I would rather you ask me what you think are the stupidest questions than not ask at all. Take your time. The people there have the experience you don't have yet. They will be doing things at unfathomable speeds that seem impossible to measure up to. You will get there with time and practice. Right now, you have to focus on safety and doing exactly what you have been taught. No shortcuts. Remember your body mechanics. Don't do a turn or anything that could hurt you or the patient. If you don't feel comfortable, make sure to take the time to get yourself into position first. This is something I've been slacking on, and trust me, you don't want to F up your body. Someone might die. As long as you didn't cause it, don't stress. Death is part of the job. The first one is always the hardest, but remember it's natural and also can be fascinating. Use your clinical mindset to work through it. Don't be afraid to talk about it. If you need to cry, do it. Be curious. Get right in there and do everything you can to help yourself advance and grow. I also like that because I feel like people are afraid of a lot of things that are quote unquote natural or common or normal within a CNA's job. And you're not doing yourself any favors by holding back or avoiding doing those procedures or providing that care. So you need to make sure that you're putting yourself out there, especially in clinicals. People know that you're there to learn, and clinicals is your time to get the experience before you go into the workplace. And so if you're going to make a mistake, clinicals is the time to do it. Because it is your time to be learning all these different things and learning the procedures and learning what you should and shouldn't do and how you should and shouldn't do things. So just keep that in mind. Somebody else said, clinicals are easy. All you do is follow an experienced CNA that will show you good tips and tricks. You're not going to be left on your own. And that was the last piece of advice. As far as the last piece of advice, I will say that it kind of depends on where you do your clinicals, whether you're going to be left alone or not. I went to a clinical site that they kind of gave us each our own assignment. Obviously, this was not the very first day of clinicals, but we each got our own assignment, and then they kind of just said, okay, now go and do what you need to do for that person. And if you have any questions, come and get me, or if you have any problems, come and get me. But for the most part, we were left to kind of have that experience on our own and do what we needed to do and just kind of learn. So it's not necessarily that you are alone per se, but you may be asked to work on your own. Like there may not be someone in the room holding your hand as you do all these tasks. Especially the further that you go through your clinical experience, I think you're going to be expected to do more and participate in more things without somebody there holding your hand, if that makes sense. So anyways, that is it. I hope that this video was helpful. Don't be afraid of clinicals. Like I said, it is a learning experience, and it's your time to figure out what it is that you need to do on a daily basis as a CNA. And like I said, if there is any time to make mistakes, clinicals would be it, because it's a learning experience. People know that you're there to learn. People know that you're not a certified CNA yet. You know, you're working your way there. So people will be, or should be, more understanding of the fact that you are new and you are still going through a learning process. So hopefully you have a good clinical experience. If you guys have any other questions or topics you'd like me to discuss on my channel in the future, please be sure to let me know. I'd be glad to get something filmed for you. And with that being said, I will talk to you guys next time.